Assemble equipment, the lubricant, antiseptic solution, and sterile gloves. Provide for client privacy. Perform hand washing for infection control. Hello, I am Hannah Gando, your nurse for today. For verification purposes, could you please state your full name and date of birth?
Yes, I'm Mrs. Madeline John, born on November 15, 1997.
Mrs. John, today I will perform an internal examination. This involves putting 2 fingers inside the vagina to determine the cervical consistency, whether it is firm or soft, the extent of cervical dilatation, the degree of cervical effacement or thinning of cervix, whether the membrane is intact or ruptured, the fetal station or where the baby's presenting part is located in the pelvis, and the fetal position. This procedure is done to assess the progress of your labor. It may be slightly uncomfortable, but it should not be painful. If you feel pain, just tell me and we will stop the procedure. Is that okay with you?
Yes, it's fine.
Your bottoms, including your underwear, must be removed for this examination. Is that okay with you?
It's okay.
So, Mrs. John, do you want to urinate or void before the procedure?
No, I just voided 5 minutes ago.
Okay. Then, can I request you to be on dorsal recumbent position, wherein you will lay on your back with your knees flexed and legs slightly open?
Yes.
Okay, then I will now assist you. Okay. So, are you comfortable in that position?
Yes, I'm comfortable.
Can we start the examination?
Yes.
Okay.
Then, I will now don gloves.
I will now apply an ample amount of lubricant on my gloved finger. Then, apply an antiseptic solution over the vulva. Then, I will inspect the external genitalia. The external genitalia does not have any irritated mucous membranes, ulcerated sores, pinpoint vesicles, or any other lesions. Hence, it is normal. There is also no leakage of amniotic fluid, umbilical prolapse, and bleeding. Since there is no leaking amniotic fluid, bleeding, and umbilical prolapse, I will now proceed to the internal examination. Please do a deep, slow breath to relax. Inhale, exhale. Inhale and exhale. Okay, I will now insert my index and middle fingers into your vagina. And direct it towards the posterior vaginal wall. Then, I will palpate for the cervical consistency. The cervix is soft. Then, I will measure the cervical dilatation. Okay. The cervix is dilated at 4 centimeters. And there is no cervical lip. Then, I will measure for the cervical effacement. The cervical effacement is approximately 50%. Then, I will feel for the membrane, whether it is intact or ruptured.
The membrane is still intact. I will now locate the ischial spines, then compare the location of the fetal presenting part to it. The fetal station is positive 1, since the presenting part is below 1 cm to the ischial spine. Then I will feel for the fetal position. The baby is in left occipital anterior position. I will now withdraw my fingers.
The cervical dilatation is 4 cm. I will now wipe your perineal area. Then drape you.
I will now doff gloves. Then I will now perform hand washing.
Mrs. John, the internal examination is now done, and the labor stage is still in progress, and we need to wait for full 10 centimeters cervical dilatation for the normal delivery of the baby. You can walk or move about carefully to help the progression of labor. For now, I will position you to the left side for ease of the labor. Then, I will now document the procedure and the assessment findings, and how well Mrs. John tolerates the procedure. Mrs. Madeline John, date of birth, November 15, 1997. There is no presence of leaking amniotic fluid, bleeding, or umbilical prolapse. Cervix soft, 4 cm cervical dilatation, no cervical lip, cervical effacement 50%, membrane intact, fetal station is positive 1, fetal position is left occipital anterior, and Mrs. John tolerates the internal examination well.